Good morning. This is Dr. Handrawada, um, and I'm here today with Alex Mangarian. And today we are going to talk about bipolar disorder, the neurobiology of bipolar disorder. This is going to be an extensive topic, but we are going to break it down into 30-minute videos. Initially, we're going to talk about different areas of the brain. We are going to talk about how inflammation and stress plays a role in bipolar disorder. And at the end, Dr. Mangarian is going to talk about the networks that is involved in the pathophysiology of bipolar disorder. Uh, so today's talk is based on an amazing article that I found on molecular psychiatry. It's called as a unified model of the pathophysiology of bipolar disorder. And the authors are, I hope I pronounced this right, Paula Magioncalda and Matteo Martino. This is published in Molecular Psychiatry 2022. Dr. Mangarian is actually going to include this article in one of the slides. So let's talk about bipolar disorder. I'm not going to go through the DSM criteria for bipolar disorder that you guys can actually look up. And we are not going to talk about the treatment of bipolar disorder. We might talk about these treatments in some other videos, but not today. Today, we are going to focus on the pathophysiology of bipolar disorder. So before I start talking about the pathophysiology of bipolar disorder, I want to talk about something called as the limbic network. The article talks about limbic network. So what is limbic network? So limbic network is a network that is responsible for processing emotions. It consists of the anterior cingulate cortex, which we call as ACC, as well as the orbitofrontal cortex, which I'll call as OFC. And we have talked in detail about anterior cingulate cortex and orbitofrontal cortex in our previous videos while we're talking about neurobiology of depression. In short, anterior cingulate cortex plays a very important role, especially in motivation, as well as something called as action outcome learning. Right? We know what motivation is. So when there is lesion to the anterior cingulate cortex, there can be loss of motivation to do things, which is basically, we also talk about lack of motivation as apathy, right? Action outcome basically means that this particular process is required for goal-directed behavior, right? That basically means that an action is performed to obtain a goal, and that is actually based on the rewarding and the punishment value that is associated with each actions, right? That is what the anterior cingulate cortex actually does. On the other hand, the orbitofrontal cortex plays a very important role, especially attaching an affective and a rewarding value to various stimuli, right? So it is usually associated with affective learning, all right? And damage to the orbitofrontal cortex, as we all know, can lead to impulsive behaviors. So in short, the orbitofrontal cortex plays an important role, especially in inhibiting inappropriate responses, all right? So your limbic network consists of the anterior cingulate cortex and the orbitofrontal cortex and its connection to the subcortical structures. So the subcortical structures includes your brainstem. It includes amygdala. It includes hippocampus. It includes the anterior thalamus. And it includes the hypothalamus. Right? So this network is called as the limbic network. And we'll talk about different areas, actually, what their function is, actually, as we move along. All right. So, this particular article talks about the effect of stress and neuroinflammation on this limbic network. This article also talks about how bipolar disorder is more or less very similar to multiple sclerosis. All right. It's just a comparison. Okay. It does not mean that bipolar disorder is multiple sclerosis. Okay. There is the pathophysiology is pretty similar, right? For example, in patients with multiple sclerosis, it's a relapsing, remitting kind of an illness. And so is bipolar disorder. There is relapses and then there is remission, right? In patients with multiple sclerosis, you do see a lot of white matter damage. Same thing happens in patients with bipolar disorder. As the disease progresses, there'll be more and more cortical loss as well as white matter disconnection seen, or white matter lesions can actually be seen. This is especially because of the microstructural damage happening to the myelin sheath. So a lot of times when you do an MRI, you might not see those white matter lesions that you see in patients with multiple sclerosis, but there is microstructural damage. And that's what we are going to talk about. So now let's dive into how stress and inflammation is responsible for bipolar disorder. All right. So whenever there is stress, right, or whenever you are exposed to an aversive stimuli, aversive stimuli is something that usually has a negative valence to it. So whenever there's an aversive stimuli, what happens is that all the sensory information is usually processed by the thalamus, right? So this is our sensory processing area in the brain. So all the sensory information goes through the thalamus except olfaction, right? We learned it in our med school. What the thalamus actually does is that it does a very brief review of these aversive stimuli, like a very quick assessment of the aversive stimuli, right? So now your cortex is not involved. This is very basic. This is very primitive, right? So once a cortex is involved, that's a very top-down cognitive control of your emotion. That takes a while, right? You want an immediate response to an aversive stimuli, right? So the thalamus is responsible for processing the sensory input, right? The sensory input could usually be from the vision, from your smell, can be from the uh, listening or the auditory area, right? So all the sensory stimuli, touch, pressure, heat, pain, whatever it is. Based on that, what happens is that the thalamus will send information to locus coeruleus. So locus coeruleus is an area in the brain that is responsible for the release of norepinephrine, right? Now, this norepinephrine that is released during stress can have different effects in the body. So one of the effects of norepinephrine that we will talk about is its effect on the T helper cells, which we'll call as Th1 and Th2, or we'll call them as CD4 and the CD8 helper cells. We are also going to talk about the effect of norepinephrine or stress on the HPA axis. Okay. And the effect of stress on something actually called as DAMP. That is called as the damage associated molecular pattern. The article doesn't talk much about DAMP, but that is something I wanted the audience to know about because DAMP is responsible for something called as a sterile inflammation. That means that you don't have to be infected by an organism like virus, bacteria, fungus, or parasites, right? Just stress actually can cause inflammation in the body that can actually mimic as if somebody actually has gotten an infection, all right? So let's talk about how stress affects these three different systems. So as we know, stress causes an increase in your norepinephrine, right? So let's talk about the effect of stress on the immune system, right? So we have our T helper cells. This T helper cell, and we're going to talk about the Th1 helper cell. Now, these are usually responsible for fighting intracellular parasites, pathogens, such as bacteria as well as virus. These Th1 cells are rich in beta 2 adrenoreceptors. So the norepinephrine that is released will act on this beta 2 adrenoreceptor, suppressing the effect of Th1 cells. So when you look at the ratio of the Th1 to Th2 cells, it will shift more towards the Th2. All right. Now, Th2 is also responsible for release of inflammatory mediators, right? So some of the pro-inflammatory cytokines that are released are interleukin 1 beta, interleukin 6, tumor necrosis factor alpha, interferon gamma, and so on, right? You don't have to remember these names of these inflammatory cytokines. I just want you to actually know that these are all inflammatory cytokines, right? So what happens is that when there is a decrease in the function of the Th1 helper cells, there's an increased risk for reactivation of herpes simplex virus, cytomegalovirus, toxoplasma, etc. And this in turn can kick in the inflammatory process by increasing the inflammatory cytokines. As we all know, that the inflammatory cytokines will affect the way tryptophan, which is a substrate or the amino acid that is required for the synthesis of serotonin. And we know this particular neurotransmitter that plays a very important role in the regulation of mood. It has a lot of other functions, right? One of the function is mood regulation. Plus, serotonin also strengthens the connection of the default mode network. And Dr. Mangarian is going to talk about default mode network in one of his talks. Tryptophan can also be converted. Only 5% of this tryptophan is converted into serotonin, right? 95% goes through a totally different pathway, which we call as the kynurenine pathway. We're not going to talk in detail. We'll talk about this particular topic some other time. There are two different enzymes that are involved in the conversion of tryptophan to kynurenine. One is called as IDO, which is called as indoleamine 2,3 dioxygenase. Now, this is stimulated by the inflammatory cytokines. So what is happening is that the tryptophan is converted into kynurenine, so we don't have enough tryptophan to form serotonin, right? So this is one of the mechanisms how serotonin can go down at the time of inflammation. And kynurenine pathway can be pretty damaging. This happens inside the microglial cells because this can form quinolinic acid, which by stimulating the NMDA receptor can be excitotoxic in nature. All right. So this is how stress affects the immune system and how the immune system can affect the serotonergic system, right? And also induce cytotoxicity. Now let's look at the effect of stress on the HPA axis. So HPA axis is the hypothalamic pituitary axis, right? Which we call as the HPA axis. As we all know that whenever there is stress, this particular axis will be stimulated, which causes an increase in the production of CRF, which is corticotropin releasing factor. All right. I'm going to talk about this in detail when we talk about anxiety disorder and the neurobiology of anxiety disorder. All right. I just want the audience to know that norepinephrine will kick in the HPA axis, increase CRF. CRF causes increase in the production of ACTH, and CRF is released from the paraventricular nucleus of the hypothalamus. ACTH is released from the pituitary. This will then act on the adrenal glands, and this will then cause the release of glucocorticoids, right? And we know the effect of glucocorticoids, right? Now, one of the effects of the glucocorticoids is again actually on the lymphocytes. As we all know, that the glucocorticoids will fluctuate, right? So during stress, it is increased, and as soon as the stress is resolved, it comes back to its physiological level. In patients with chronic stress, the glucocorticoid level fluctuation stops, and you usually see a very high level of glucocorticoid in the system because the body is continuously stressed. And this can actually lead to glucocorticoid receptor resistance, right? So one of the places where the glucocorticoid will act on are the lymphocytes. And these lymphocytes are rich in glucocorticoid receptor. What glucocorticoid normally does is, so when it binds to this glucocorticoid receptor, it can inhibit the lymphocytes, and thus it can decrease the release of inflammatory cytokines. But when you develop a glucocorticoid receptor resistance, then these lymphocytes are not inhibited. This causes an increase in the release of inflammatory cytokines. And then we know the story. The inflammatory cytokines can then stimulate the IDO system. All right. Pause. Now let's talk about the effect of stress on something called as DAMP, that is damage associated molecular patterns. This is something that a lot of people will not talk about. This is not there in the article either. But I want to stress about this particular phenomenon. This causes something called as sterile inflammation. And I'm sure you guys might have read about it in your undergrad or in your med school. So this will be a refresher for people who have already know about it or heard about it. So what stress causes, as we know, stress causes an increase in the release of norepinephrine. I'm going to make this a little bit bright or darker. Let me see if I can do it. Just bear with me. Okay. So stress causes an increase in the release of norepinephrine. What this norepinephrine actually does is, so there is exosomal systems in our body, right? So let's consider, I'm just going to draw this way, okay? So this is just a cartoon, okay? So let's consider this to be exosome. So what stress actually does is that it increases norepinephrine, and it stimulates the alpha-1 adrenoreceptors on the exosomes. The stimulation of this exosomes causes the release of something called as DAMP. That is, as we mentioned, this is damage associated molecular pattern. Right? So stress causes release of norepinephrine. Norepinephrine will then act on the alpha-1 adrenoreceptors on exosomes, causing the release of damage-associated molecular pattern. Now, these circulating exosomes, right, they're pretty rich in immunostimulatory molecules, right? One of them actually is the heat shock protein 72. We guys know or heard about it. All right. And they are depleted of immunoinhibitory molecules, right, which is called as the microRNAs, right? So what happens is that, so as we mentioned, norepinephrine that is released act on the alpha-1 adrenoreceptors on the exosomes, causing the release of DAMP, right? So which is called exosomal associated DAMPs. And this circulating exosome are rich in immunostimulatory molecule and are depleted of the immunoinhibitory molecule. What this does is that it usually activates the pattern recognizing receptors on immune cells. And this will amplify the inflammatory signals. So again, this will stimulate the release of cytokines. So this particular pathway, stress, can cause something called as the sterile inflammation, right? So you can have inflammation in the body even without having an infection, right? One of the example is actually we say obesity is an inflammatory state. So people are like, how is obesity an inflammatory state? Because 60%, because I'm so sorry, because 30% of interleukin 6, which is an inflammatory cytokine, is released by your adipose tissue. Okay. And as we know, inflammatory cytokines can actually cause a lot of damage. All right. I know this is a lot, but you all went to med school, so this should not be an issue. But you don't have to remember everything. I just want you to remember what stress can do. Now, stress can also cause the release of dynorphin. This is an opiate that is released under stressful situation. And what dynorphin does is that it acts on kappa opioid receptor. So when dynorphin stimulates kappa opioid receptor, it can actually cause phosphorylation, something called as P38 MAP kinase, mitogen associated protein kinase. I don't want you guys to remember all these things. Just stay with me. When you cause the phosphorylation of P38 MAP kinase, what it does is that it will cause an upregulation of monoamine transporters. Especially the norepinephrine transporter and the serotonin transporters. So what happens when the monoamine transporters are upregulated? It will cause more uptake of serotonin, which we call as 5-HT, norepinephrine, that is NE, as well as dopamine. Now you might ask, why dopamine? There is no dopamine transporters upregulated. That is true. But in the prefrontal cortex, dopamine, you don't have dopamine transporters. So dopamine is usually taken up by the norepinephrine transporters, right? So what happens is that when you upregulate these monoamine transporters, you cause the depletion of these monoamines, serotonin, norepinephrine, and dopamine from the synaptic clefts. And this depletion, as we all know, can cause mood instability and emotional dysregulation. Right? So I'm going to end my video right here. So as we talked, to summarize, stress is going to be an important factor precipitating bipolar disorder. As we know, stress does precipitate manic, hypomanic, as well as depressive episodes. and the effect of stress on the immune system that causes the release of inflammatory cytokines, the effect of stress on the HPA axis, which causes an increase in the release of glucocorticoid, and finally, we develop glucocorticoid resistance, which in turn can cause an increase in the cytokines by its effect on the lymphocytes, the effect of stress on release of exosomal associated damage associated molecular patterns, and how they in turn stimulates inflammation, and the effect on dynorphin system.